My name's Azora.
My name's Sky.
Our topic is over how parental drug abuse affects children. You all have been given surveys. We are now going to go over how those questions relate to substance abuse.
Number 1. Do you have any family history of substance abuse or addiction? Substance abuse is genetic. About 40% to 60% of children with a family history of addiction get addicted to that drug or another. There's a 54% chance that those children will not be able to quit that drug.
Number 2. Are you currently experiencing any financial stressors? Substance abuse can be caused by and led to financial stress. If you are worrying about financial problems, then that can lead you to self-medicating with various drugs. Financial problems can be caused by substance abuse because most addicts will spend more money on drugs than anything else.
Number 3. Are you currently experiencing any relationship stressors? Relationship stressors can cause more addictions. If something happens within a relationship and you don't have healthy coping mechanisms, it can lead you to a substance to try to calm yourself down. When you started that addiction, it can lead to even more relationship problems because of that addiction.
Number 4, are you currently experiencing any work-related stressors? When a person is faced with multiple deadlines or works in a hostile environment, it can lead them to certain substances to help keep them focused and work for longer hours. The more you take, the more you're feeding your addiction.
Number 5, what is your current living situation? Do you have stable housing? When you are living with a parent that has substance abuse, you have less parental guidance than you normally would in a stable household. When you have less guidance, then you're more likely to try things you shouldn't try.
Number 6, how has parental drug dependency impacted your life? Parental drug abuse can affect your mental health, physical health, and emotional health.
Number 7, what is your mental health history? If you have a mental disorder, you are more likely to get addicted to a substance. Your brain lacks certain neurotransmitters. You look for it in various things, including substances.
If you have answered yes to 3 or more of these questions, you are more likely to have a substance abuse disorder when you're older. You can also take a test called the ACE test. ACE stands for Adverse Childhood Experiences. It will show you the risks later in your life based on your answers.
Why did we select this topic? We selected this topic in order to explain that not only does it affect the health of the parent, it can affect the child's physical and emotional health. We felt it's not enough and people know how it can affect the child.
The different types of abuse are individual, group, and family therapy, along with detoxification and medication-assisted therapies.
The 5 stages of treatment and how long the treatment may take depending on how severe the addiction is in the individual.
Rehab can last 30 days to 2 years. The first stage is pre-contemplation, which is engagement. Second stage is contemplation, which is persuasion. Third is preparation, which is also persuasion. Fourth stage is action, which is active treatment. Fifth and last stage is maintenance, which is relapse prevention and recovery.
The advantages of longer rehab programs. Longer treatments allow a patient more time to become acclimated to that treatment process. Partake in programs after detox to create long-term goals. Live in a supportive household, a supportive environment away from at-home triggers. Understand their addiction and triggers on a deeper level.
Parents can help protect kids against substance abuse by giving them facts before they are put into a risky situation. It could cause the child to be abused inside the home, and if the parents are abusing drugs while pregnant, it could cause the child to be born addicted to that drug.
The types of abuse that may occur inside a household with substance abuse. Different types are physical, emotional, sexual, mental, domestic, and financial abuse.
The effects on children. When kids experience certain trauma when young, they are more susceptible to mental illnesses and can affect their physical health. Compared to their peers, children of substance-abusing parents show increased rates of anxiety, depression, optional behavior, conduct problems, and aggressive behavior, as well as social competence, lower rates of self-esteem and social competence.
Children and young adults who are dealing with a parent with parents who are addicted to or misusing drugs and alcohol can often be seen to being angry and aggressive more often than not, having behavioral problems, facing psychological challenges, having poor general lack of educational attainment, and low self-esteem.
Children with parental substance abuse versus children without. Children with parental substance abuse. 1 in 8 children ages 17 or younger are living in households with at least one parent with a substance disorder. Substance abuse is genetic. About 40% to 60% of children get addicted to a drug.
Children without parental substance abuse. The child's academic success rate is higher, and their emotional health is better because of the parental support. Parenting styles with substance abuse. Neglectful, uninvolved, permissive, and rejectful.
Parenting styles without substance abuse. Nurturing, guiding, authoritative, and empowering. Effects of drugs while pregnant. Miscarriage, preterm labor, birth defects, stillborn withdrawal symptoms in the baby after birth, a higher risk of sudden infant death syndrome, and poor fetal growth rate.
When addiction is controlled, everyone loses. Parents and children, extended family, and friends. Fortunately, people can heal from addiction. Families can reconnect, and parent-children bonds can be mended when recovery is chosen. Substance use disorder is powerful and destructive, but it doesn't have to be the end of the story. Recovery is an option. Healing is possible.
And there's some helplines. Do y'all have any questions? I'm not answering your questions, Tony. You can go ahead and